My name is Elkousy. I work at Fondren Orthopedic Group and I specialize in shoulder and knee surgery. I have 3 boys and they play sports. They're teenage years. 2 of them are fencers and 1 of them plays soccer. And so I spend a lot of my time going to their competitions and taking them to practice. Of course, my wife does most of the work, but I help. On a recreational basis, when I grew up, I was a big soccer player, tennis player. I played basketball. I was actually recruited in college for soccer and tennis, but didn't go because I preferred to study and become a doctor instead. First of all, I chose medicine simply because I like taking care of people, but I chose orthopedics in particular because I always grew up playing sports. An athlete is a broad definition. It's anybody from 10 years old to 100 years old. So I like taking care of people, like getting them back on their feet, like allowing them to get back to doing the things that they love doing. My favorite time taking care of patients, not in a bad way, is the last time that I see them. If they say anything to the effect of, "Thank you, I'm better, you've helped me," that's what it's all about. That's what we work for. So when I first started, I did do knee replacements. That was part of the thing that I did. And there are 2 reasons I don't do them anymore. One is because they consume your clinic. So, if you do knee replacements, all of a sudden everybody you see needs a knee replacement and you don't do anything else. And that was number 1. Number 2 is we started getting partners that just specialized in knee and hip replacements. And so when we specialize like that, it's good just to send them all to one person who just does that one thing, and then I get what I just do one thing of. It can always be difficult to get a hold of a doctor's office, but one way is asynchronous communication. We're really good at that, and so if you can't get through to us through a phone call, don't fret. Please, send an email through our portal or go through the portal. We can communicate with you. We don't discount that. So the best way to communicate with us in our office is asynchronous communication through the portal or through email. The way I live life, if you laugh, you think, and you cry in one day, then you've had a full day. And so for me, I just want to enjoy the day. I want to enjoy what I'm doing, and I do that. And even the most difficult patients or the difficult surgeries or a long day, there's always something good about it. I'm luckier than others. And so you just have to always remember that. You have to take everything in perspective.